I think we have really learned a lot in this first African conference. We've learned that for us to offer best services, healthcare services for our inmates and even for the prison officers who work in prison centers, we need to uphold the rule of law. We need to incorporate the Mandela rules. We need to read through the Berlin Conference rules and even the Geneva Declaration. I came to this conference with a presentation where we were using a prison's health record form, that is a PF10 form. This is a form that was initiated by the AIDS Control Unit just to screen HIV and TB. But then at Kisumu Maximum Prison, we enjoined this PF10 form to just screen all other diseases immediately after COVID-19. So we used this form to make sure that all detainees, all the prisoners who are coming to prisons were being screened on admission. They were accessing the health services on admission, and if not on admission, at least 24 hours within their presence in prison. So this is something that has worked well for us, and we've managed to make sure that all detainees who are coming to prisons, we have their records, we make sure we attend to them. Those who have pre-conditions while they're coming in prisons, they are accessed immediately. For example, those who have asthma, those who have diabetes, those who have hypertension, they continue with the care. And also in this triple effort screening using the PF10, here is where we use the prison officers. Remember, the documentation officers, these are prison staffs who don't have a medical background, but they have been trained on how to elicit these questions through to the prisoners and get these prisoners immediately and link them to the medical team and make sure they access the health services. For the emergency cases, we make sure we do immediate referrals. So this is something that most African countries have picked up. Most of them are not using prison officers as an entry point to make sure that health services are cascaded to our clients immediately as they come into prisons. So something that came up that has not been more researched on and maybe worked upon is mental health. Mental health now has become a human right issue, and it's not only for the detainees. Remember, as you come to prison, already that is a punishment on itself. The culture shock, as you come, even if you didn't have a mental health issue, already you develop it on arrival to prisons. Apart from the prisoners who come to prison, we also have prison officers. We also have the healthcare workers working in prison who need to be taken care of. So as we take care of our customers, let's also take care of ourselves. Throughout the conference, we've really borrowed a lot. We've borrowed a lot from Ghana, from Nigeria, from Uganda, from Somalia. There is quite a lot that's happening in African context. They are really doing a lot. They are also using the prison officers like us. We are healthcare workers, doctors, nurses, clinical officers who are employed by the prison service. We've learned that even in those countries, they are also employing prison officers. But also we've learned that health is a function of the Ministry of Health. So there is no way prison will work in isolation without involving the Ministry of Health. So Ministry of Health has to take this up and make sure that the prisoners, because they come from community, they belong to community, they vote to the governors, the MPs, as the county government's budget for the health of our community and their constituencies. Let also take prisoners one of the working areas. They would want that these people, as they come to prison, this is a public health issue, they'll go back to the community. So if they're not well taken care of in the prisons, they'll carry out or they'll take the infections back to the community. So this is a presentation that I tendered to the conference, a best practice from Kisumu Maximum Prison on triple effort screening and medical care. This is a strategy that has ensured that we have equal focus on all inmates accessing health services, real-time screening, risk assessment, and prioritizing quality of care that we offer. So this is where we employ the use of PF10. This is a prisoner's health record that initially was being used to screen HIV and TB only, but on the verge of COVID-19, it was revised, and now it had to include the COVID-19 screening, and also it encompasses all other healthcare components. This is whereby we use the prison officers. These are documentation officers. They are trained on this PF10 form. They use this one on admission of prisoners to prisons. So as they ask these classical questions, they would usually realize maybe this prisoner is asthmatic or this prisoner is hypertensive or maybe was taking medication before coming to prison. So they will immediately be linked to the healthcare team, where they will go directly to the triage area. Now from the documentation office, they will go to triage area. At the triage area, they will meet the healthcare workers and the peer educators. The health education will be done there. The taking of the vitals will happen, where the screening of the blood pressure, diabetes, the anthropometrical readings, that is the height and weight, and the BMI will be calculated. So this one also enable us to know if you came to prison with malnutrition, so that we could put immediate intervention, and all other health cascade areas that would need attention. And then immediately from the triage area, one will be taken to the clinical desk, where you'll meet the prison doctors and the nurses. Here is where the care will happen, the screening, the proper history taking will happen. If it's a case of management within the prison, it will be done. If it is a case of referral, then we'll do the immediate referral. So these strategies has enabled us to have no cases of prisoners missing to get health services. It has improved early detection of cases and prioritizing care and treatment. It has also reduced delays and also reduced stigma and discrimination. It has also promoted the package that now we call the exit package, because once you come to prison, we teach you on health and the promotion of the services we offer, so that when you're exiting prison, we can again give you the exit package, so that you go out to the community and continue with the prevention. So this is the overall overview of the triple effort screening and medical care at Kisumu Maximum Prison. So the conclusion is that this strategy can be replicated in other prisons, and also it can also be emphasized as to include all the multidisciplinary. As you see at Kisumu Maximum, we were using the prison officers at the entry point, as the entry point to medical care. So if we can be all inclusive, the prison administration, the healthcare workers, the Ministry of Health, then our prisons will be where we would want to be as a country, because we are told we are not judged but by how we treat the high of our people in the community, but the lowly ones, and more so those who are in prisons. Thank you, and over.